Hey everyone, hope you can hear me, and thanks for the introduction. Let me just quickly share my screen, and yeah, I see myself on the screen as well. Yeah, so hey everyone, greetings from Riga, Latvia. I'm very sorry that I cannot be with you, but Tallinn has been a place to come for the last 3 weeks, so every week I come to Tallinn. But nevertheless, thank you so much for your time. And yes, so I will be giving a short and rather brief case study coming from Latvia, but working with international partners as well from a perspective of reuse of health data. So as I understood, you've had both the previous speaker as well as the sessions today are also devoted to primary data use and processing. I'll be talking more about the secondary one, but nevertheless, coming back to the topic and running forward. So yeah, I already had an intro, but basically for the last more than a decade, I've built solutions in healthcare, starting from sensor systems, data applications, patient engagement for clinical research and other things. So a couple of hats I wear. I work as a part of Digital Health Council by the Minister of Health here in Latvia, as well as we've built eventually the largest digital health data startup in Baltics back in the days with around 1 million patients that use our solutions for engagement, collection of patient-reported data, and combining this with clinical diagnostics data for patient-reported outcomes in RWU studies. But basically, yeah, coming back to the case study, and I think one of the things we try to put in Latvia is how to use and reuse and apply data that we collect during everyday processes for the sake of innovations and cultivating novel solutions, both coming from therapeutic area like drug discovery, ending up, with applications in AI and more patient-centric care, as the previous speaker outlined. And basically, one of the concepts we try to change is how to become a data insight co-creators, as we call it, from data donors. So by data donors, I mean that we just pass along our data to consortium members for the sake of further analytics, normalization, and in combination, but more looking into how can we apply our own infrastructure to actually innovators come to Latvia and come to our ecosystem and utilize the data that we have. And for sure, like now, and I will be having a slide about the state of the art in Latvia currently. What we're looking also in the global tendencies and the trends. And for sure, one of the examples we are now talking, actually we'll be having a talk in 1 hour in the Minister of Health, is how to utilize an ecosystem to grant access, a secured and privacy preserving access to data coming from the diagnostic space. And this is an example of France doing a portrait consortium with OpenAI in the institutes in France, basically combining and digitizing pathology slides and putting them in one secure server infrastructure to actually gain access for the researchers for training AI models or performing any analytics operations on top of the data using trusted research environment. But apart from that, for sure, the clinical use case is there. So basically, every new patient case can refer to the database already collected throughout the years. And another trend that we're looking in Latvia, at least, is for sure is how can we apply the data to support innovations, and especially the ones coming as an example in drug discovery, with the first AI drug discovered drug molecule candidates being successful in phase 2B trials, actually by the company founded by a Latvian founder, Alex Jabrankov. And for sure, what we've put now in the discussion, one of the conferences just a couple of months ago, is that how can we hop on top of the shift of paradigm? And as it was outlined, one of the documentaries last year is that each country that has a good data and computational infrastructure basically can, I would not say become a powerhouse, but rather, benefit and contribute to the drug discovery process quite dramatically. But coming back to Latvia, so what is the state of the art? And for sure, it's not that easy to put it just, within a matter of 1 or 2 slides. But what we have, and kudos to colleagues from Finland as well as from Estonia, a lot of things to learn from you. Already made a couple of screenshots for the colleagues from the previous presentation. But the challenges, I think, it's not only applicable to our country. It's basically the fragmentation within the data ecosystem and lack of related strategy so far. We've had digital health strategy there, which is basically is focused more on, on novel services or, better care, but the chapter to be outlined towards data interoperability, data collection standards, data exchange standards it was not there. And another thing for sure that we're fighting with in Latvia and the challenge is a legacy created by the vendors on healthcare provider level. And it's for sure having, several vendors that do not have a unified governance structure and unified standards in front of their companies, in front of the developers, for sure leads us to a situation that we have quite a lot of proprietary standards and data models that are, used within, for a decade or more. And then basically we generate quite a lot of legacy that is not that easy and not that cheap actually to transform to the unified concept because of financial restrictions as well. And the third of all, for sure, as I mentioned before, so governance and standards for data collection exchange are yet to be set up and mandated. And but it's not only challenges, but for sure the progress is there. And I think I will start from the last one. Is last year the Ministry of Health actually established and opened up and running Latvian Digital Health Center for in order to provide not only the governance and strategic execution for e-health ecosystem as a national e-health resource, but also go, as I might say, a level deeper or level lower and help and provide assistance and guidance for healthcare providers as well, coming from a public health as an example, vertical to go and shift from the legacy vendors towards something that would be compliant with the data standards for data collection and exchange, as well as also for openness of solutions, which is another challenge that we have. It's not that easy to connect to the hospital information system, and not talking about the privacy sensitivity, but rather technical aspect that we have closed vendors that are not utilizing and publishing either APIs, so we don't have any developer portals and sandboxes to actually for innovators to come and validate their solution and inhale this in the hospital ecosystem, as an example, any provider ecosystem. But yeah, and we also finally we're moving toward becoming members of SNOMED CT. I've seen it in the previous speaker slides. So basically what we have there now as a challenge for sure is identifying the needs, and I very much agree what the previous speaker meant. Basically, the first thing we were now talking about is how to identify the first chapters and first needs to move forward with both localization as well as moving from a legacy towards shifting to SNOMED CT and standards alike. And for sure, the good thing is that was transfer for FHIR-HL7 within multiple e-health modules starting, I think, last year. Yeah. But what we hold in front of our eyes, actually, in Latvian Digital Health Center, is also that the good examples of countries, and I put Finland. Kudos to you guys. That having the best healthcare data in the world is something that we're looking for in Latvia for sure as well. And especially knowing that successfully last year we granted a couple of pan-European consortium leadership positions in Latvian oncology and oncology screening as an example. So coming back to the case study, what we did as first steps, I might say last year, is there will be like two parts of that. The first one is for sure how to work on a day-to-day practice and patient journey practice where we do have quite a lot of challenges. And for sure, this one is an example coming from the hemophilia patients and the department related in the hospital, where for years we collect quite a lot of paper-based and structured data per se, which is not to be utilized nor for the primary purposes, nor for the secondary purposes. And this is just an example, that I made a photo before the presentation coming from, a diary of the patient using this, being treated from hemophilia and using the therapy that is being prescribed for the patients diagnosed. And they're filling in, the monthly report and imagining, how it is to utilize such data, both for the clinical needs as well as for the secondary needs for sure. So what we did as an example, and what we're putting on right now, is digitizing the pathways, both for patient-reported outcome measures as well as for, just a simple just a simple symptom checks as well as e-diaries. And this is the example of the patient portal in Children's Hospital, which digitized the process of basically prescribing the symptoms through the e-diary system and, entering this so the data is structured and used by the practitioners as well by researchers. But it's coming from, level or layer beyond it on the institutional level. What we faced is that we do collect quite a lot of data as well as all other countries and players do. But the problem was that it's not only the thing how to utilize this data, but rather also how to understand what data we collect. And this is something that we ran as a pilot in 6 institutions, including the National Biobank, the regional hospital as well, one of clinical university hospitals, one of the main ones in Latvia, where we basically, apart from working on the legacy level and trying to unify the data that's being collected, we started from another way around, which might not be the smartest way, but I will explain what we've reached with that. And we've extrapolated and we worked with the metadata. So we extrapolated metadata, ran this randomization pipeline, and tried to unify those, which was a bit of a harsh work. But nevertheless, what we did, we've put this on the open data portal as an ability to stratify the data and the data collections and subset the data in real time by using the metadata criteria. So basically, and having the pointers to exact data servers and server infrastructure coming from registries, hospitals, whether it's a biobank or any other institution that were a part of the pilot. And this is just an example of type 1 diabetes registry that is being governed by University Hospital and the University of Latvia, where before that, they were just sending out the data extracts to the partners so they can govern and have it in one place. And then we try to shift the paradigm of not sending the data, but rather giving access to the metadata with a stratification tool. So researchers that would like to get access to our data, playing around with the inclusion-exclusion criteria of the data set collected as in the patient cases, and then seeing in real time what is the cohort and sending the request with exact query parameters that we fetch and run automatically on the server infrastructure of an institution. So the next step for sure is not only to get understanding, but also get access to that. And this is something that we're working on right now in Latvia with a set of pilots where we utilize opportunities of trusted research environments as well as federated learning. So most probably all of you are familiar with the federated learning concept, but what we do, we create a multi-tenant architecture now where the first part comes with the metadata with the curation and stratification, but once it's being done, we send the request parameters, both for the IT department, in some of the institutions automatically fetching the data from the database, just one institution to be very honest, and then putting this subset of data with a manual automatically now on the cloud tenant, and we're using Microsoft Azure for that for the sake of the pilots, where researchers can get access, time-based access to run their own scripts, or run visualization pipelines, or even train AI models on top of this data. And just to showcase what, so basically it's institutional level, but what about pan-institutional level? Because innovations cannot be developed, by just one country or one institution per se. So this is where we now are working within TOGAS and the EU for Health initiative, where there are multiple countries, and the challenge is still the same. So we have quite a lot of legacy vendors or systems where data is being collected. And if the principal investigator is to look on this data as, as an overarching on an umbrella type, it's not that easy to do that. And for sure, one of the ways to do that is to put data in one place, which is not the case. But what we're doing there is utilizing exactly the same concept where we extrapolate metadata. And on top of that, we're working on creating a unified encoding library, knowing that the legacy is not that easy to change or unify within multiple countries. What we do, we just create a dictionary from the sites and then running the script to actually, when the data is being fetched for further analysis, we just map it towards the unified encoding library to normalize the data and put it on the trusted research environment for further data analysis, which might sound a bit crazy, but this is where we are in terms of reaching the deadline for the next year. Yeah, and another thing for sure is what we've did in Latvia is digitizing the consent process. It's not so much about interoperability rather than ability to actually generate prospective data points. And this is what we did with our state genome bank and around 8 hospitals in Latvia, where for the registries, as we call it, patient-centric or dynamic patients registries, so we're a part of, signing broad consent and going to the institution for any screening or follow-up activities. We use a digitized tool to actually sign, manage the consent, and receive any other consent requests together with the pre-screening questionnaires or anything else on top of that through mobile, laptop, or tablet. But I will not stop here too much. And this is just an example of creating this where we utilize this and then on a regional level right now. So we use it for digitizing the screening initiative. And we did a program for personalized breast, cervical cancer, and menopause awareness, as well as screening rates increase program, where we engaged with this concept around 20,000 women in Latvia to sign the consent, basically being engaged, receive educational and call to action materials. But on a level beyond it, we extrapolate metadata and showcase this to the Center for Disease and Control and Prevention of Latvia. So as an example, we just now published information about the cervical cancer and HPV vaccination that we know 200s of women among this group that were talked out of HPV vaccination by the GP practice as an example. And we can pinpoint and basically personalize the communication through the digitized tool and through the data that we collect towards better care and better screening rates in that case. But coming back to some final thoughts, is it will not be as anecdotal as the last speakers, but I do think that, for sure, governance is an axiom. Governance is very important. But the thing is that, as an example, the same SNOMED, what we have now in the policy-making shift is that we need to do quite a lot of background work in order to shift the paradigm there. So what we try to do now is to get into unified standards will take some time also within one country. So we try to execute on initiatives where we are granted funding, as an example, EU or research initiatives, and start moving forward. And what we've seen as well with the same metadata curation thing, that some players were actually, we created some kind of a fear of missing out concept, where through, attracting more research interest, where they received requests stating, oh, you have such an interesting data set, we would like to collaborate. This actually shifted a bit the paradigm from a management perspective, how to invest even more on data standardization and actually, invest in the infrastructural level as well. So that's briefly it. I think I ran out of time, actually. So thank you very much. And if you have any questions or comments, we'll be happy to respond to that, both offline or online. Thank you.
Thank you very much. We would have to take the questions afterwards, so we can continue right now. Sorry. Thanks a lot for joining us.